Good afternoon, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm so pleased to have with me in the interview studio Deanna Wise, who is Chief Information Officer at Dignity Health. Hi there, Deanna, how are you?
Hi, thank you, thank you.
What are some of the things that you're talking about at the conference today?
I'm talking about meaningful use and patient-centered portals.
Okay, and you have quite an executive team that's working on this at Dignity. What are some of the, what's the focus of the team, and what are you trying to achieve in putting this together?
Yeah, we do have a wide cast of characters. Dignity Health has actually been on this for several years. And as we have transitioned forward, what we found interesting is really thinking about, like any project, it's who are your influencers. It's not just what are their titles, but it really is who can influence the project. And so with that, we've got a wide group of people throughout the whole entire enterprise, whether it be even the administration team, the caregivers, various people. We think about the physicians, all across the organization. Okay. And I think one of the things that people miss the most about it is thinking about who are your outside influencers, so your government agencies. A big part of meaningful use too is actually being able to connect to those public health organizations. And so I think a lot of times people take for granted that what you have to do in order to connect with the outside. And yes, connecting with them. So part of that is bringing the lab testing, the immunizations, as well as the outbreaks and things like that.
Tell me more about Dignity Health and the markets and customers you serve.
Yeah, so Dignity Health is across 3 states. As far as our acute side, we have 39 hospitals, but we actually have greater than 400 ancillary units across 20 states. We're a $15 billion company. We have 55,000 employees and roughly 9,000 physicians integrated within our system.
And you also have a system in place, a patient portal, and access to that is a key component of what you're doing?
We do. We're very focused. Part of our mission and faith-based values at Dignity Health is putting the patient in the center of their care. One of the things that's interesting as we've went down this path is a side note on meaningful use is it probably moved us a little too quickly down the path of integrating with the patient before it was ready in order to make that meaningful use component. Because what we're looking for as a consumer, when you think of yourself, what are you looking for as far as the patient portal and the value that you expect to get? Many of the technologies out there today aren't quite ready for the things that we want as consumers. When you think of your banking portal, the value that it adds. Unfortunately, in the healthcare, a lot of the information, there's debates on how quickly the patient gets the information. Does the patient get it before the physician gets the information? What do they get it at the same time? How do you assess and organize that? And being in 3 states for our acute, we also have to follow the regulatory laws within those different states.
So what has Dignity learned that might be of value for others, companies, to learn about what you've done?
Wow, where to start? I really do think it's about being strategic in what you're trying to do and less tactical in checking the box. I think one of the challenges is you're moving so fast in order to meet the needs of the organization, but really thinking strategic about what you're trying to achieve and make sure that you just don't rush in to check the box and really think about the long term versus just the short term.
And another key takeaway that you'll have for people here?
I would say keep the patient center in mind. With our faith-based and mission, it's very important to us to think about the quality and the safety of the patient and to keep that always at the forefront of what you're trying to do.
Okay. Deanna, thank you so much for your time
today.
Thank you.
I appreciate it.
And I'm Mabel Jong. Thanks for watching.